Welcome to Thomas Eye Group LASIK. We appreciate you coming out tonight. I always start out the seminars by asking everyone, how many people have been thinking about doing laser vision correction for at least 6 months? Raise your hand. Okay. Leave your hand up if you've been thinking about it for a year. Okay. How about 2 or 3 years? Over 5 years? Okay. What is the reason why you haven't done it? Is there a specific reason that popped in your mind when I asked you that question? Money?
Risks.
Risks? That's a good one. How about time? How much time it would take?
The quality of laser, which ones, I mean, you don't know which one to go for.
Absolutely. It's hard to know when you're comparing apples with apples. Right. Absolutely. And all of those are reasons. Technology, the experience of the staff in the center, the doctor, money, and the one that, what did you say?
I didn't say anything, not yet.
You said?
Risks.
Risks/fears. And normally what makes people hesitate is the fear of the risks, the fear of having the procedure. Our goal tonight is to take some of that fear away, and so that you can make an educated decision about having laser vision correction, whether it be here or wherever you end up having it. Our goal tonight is to give you the tools to be able to make that decision. And so what we're going to do is have a two-way conversation tonight. So if you have a question while we're presenting to you, please make sure that you raise your hand and we'll take care of that question, okay? So what we're going to do is start with a little video that kind of summarizes what we do here, which is Bladeless LASIK.
In the decade or so since the invention of laser vision correction, a lot has been said and a lot of confusion has been created. Here's the real story about what happens before, during, and after your eye LASIK procedure. The eye LASIK procedure uses very sophisticated technology, but the process itself is straightforward. When we look at an object, a complex chain of events must happen to form an image. First, light enters the eye through the cornea, where it is bent or refracted. Then it passes through the pupil and into the lens, where it is bent or refracted again. And then light comes to a point or focuses on the retina. Most normal vision problems occur because of some inability to focus the image correctly on the retina. Nearsightedness, farsightedness, and astigmatism occur when there's a problem accurately refracting or bending the incoming light. The eye LASIK procedure corrects this problem by reshaping the cornea so the refracted light focuses accurately on the retina. LASIK is an elective procedure and isn't for everyone. Please see a qualified ophthalmologist to discuss candidacy, indications, risks, and complications, and be sure to ask for a patient information booklet to help you make an educated decision. Before having the eye LASIK procedure, there's a critical evaluation step. Your physician will perform a variety of painless tests to gauge the health of your eyes and document your personal eye characteristics. During this process, some people may find out that they are not good candidates, but most healthy adults are good candidates. Next, your physician will take a detailed picture of your eyes. This picture creates a 3D map of each eye, what we call a customized wave scan, and this one-of-a-kind snapshot serves as the individual roadmap for your eye LASIK procedure. This mapping step is what enables you to get a truly personalized result. And when you hear advertisements for on-sale LASIK, it's usually assembly line LASIK, not the customized eye LASIK procedure. Now you're ready to have the eye LASIK procedure. Your physician will give you medication that relaxes you, and he or she will apply numbing drops to your eyes. This prescription combination means you probably won't feel anything except some slight pressure. To reshape your cornea, your physician will make a thin flap on the surface of your cornea. With the eye LASIK procedure, physicians use a precise and virtually painless laser to create this flap. This is another component that makes the eye LASIK procedure the most advanced vision correction procedure, because some vision correction surgeries use a blade to make this flap. When the corneal flap is safely and precisely made, a second laser is used to make the actual correction to the cornea. The laser is a cool laser, so you won't feel a thing. The entire correction usually only takes seconds per eye. Again, it is important to remember that with the eye LASIK procedure, this correction is ultra-precise and truly personal. The laser works automatically and is driven by the computerized information that was gathered during your personal evaluation. You should know that the second laser used during the eye LASIK procedure is ultra-precise. It uses something we call iris registration and active track 3D active eye tracking, technologies that make sure the laser stays precisely aligned even if you move your eye. The corneal flap will then be repositioned and your eye LASIK procedure is complete. The entire procedure is typically completed in about 20 minutes. Many people sit up and notice dramatically better vision. When you go home, you will be given some eye shields to prevent you from inadvertently bumping or rubbing your eyes. Then you will return to your physician for a series of follow-up appointments to ensure that everything is okay. With the eye LASIK procedure, most people experience 20/20 vision or better, so you can go out and enjoy life.
Okay, so tonight what we're going to do again is we're going to give you the tools to be able to make some good decisions about whether laser vision correction is right for you and which facility that you should have it at. Of course, we're going to tell you why you should have it with us, but we want you to be able to have that knowledge. I'm going to be giving a short presentation, and then I wanted to introduce to you Dr. Jeffrey Carlisle, who is our LASIK surgeon, and he was going to go over and talk about the procedure as well with you. So first of all, there are 3 different things that we need to think about when you're deciding where to have laser vision correction: the experience, the technology, and the outcomes. And so we're going to go through each 3 of these, and if you would take those 3 items and compare wherever you're looking to have laser vision correction, you're going to be able to make a good choice in the end. So first of all, we're going to talk about experience. It's very important that you choose a facility that is a world-class facility, a facility that has been around for a while, and also one that is not a one-trick pony. In other words, one that is going to do other procedures besides LASIK to keep the lights on. Thomas Eye Group, we just celebrated our 41st anniversary and are in our 41st year, and we've been around since 1974. We also specialize in pediatrics, glaucoma, retina. We have optical services, cataracts, well eye exam, and oculoplastics. If you came to us for LASIK, you could continue with us for regular eye care. Dr. Carlisle and the staff has performed over 25,000 eye procedures, so we've done it for a long time, and we know our business. Secondly, technology. Technology is very important because there's many different laser platforms that you can choose from. Thomas Eye Group has the latest technology. We use the eye LASIK suite, which is a Vizx product, and that suite is a phenomenal suite simply because it talks to each other from the diagnostic equipment through the bladeless flap maker to the laser that fixes your vision. It's all connected and all related, and will give you the best procedure that you possibly could have. In Atlanta, there's one eye LASIK suite that has all of the equipment, and it's us. Other facilities have maybe the excimer laser by Vizx, but they might have another diagnostic piece of equipment, so they've kind of pieced it together. We have the latest and greatest. We have the 5th generation, which is the last one that came out in the last couple years. Has all the bells and whistles. Also, with our technology, with the Vizx product, they've done over 4 million procedures worldwide as of today. And so there's a lot of proven track record behind them and experience. Also, thirdly, with technology, and this is really important, your LASIK provider needs to have some sort of a personalized treatment system, which means that you need your LASIK provider to make sure that the treatment plan that they make for you is personalized to you. And we do this here by something called wavefront technology. And Dr. Carlisle will get into that a little bit. But a personalized treatment plan, that's what you want to make sure you ask that you're going to have. Results are usually measured in 2 different ways. One of the ways, and people always ask at consultations, is, well, will I have to have the surgery again? Well, industry standards, about 10% of the patients have to have what we call an enhancement, touch-up, tweaking, adjustment, means all the same thing. Come back in, have the surgery again, where we go back in, shave a little bit more tissue here and there to adjust your vision. So 10% nationally. Our rate is less than 4%. It's not magic why our rate's that way. Our rate's that way because of our surgeon who will say no to you. If you're not a good candidate, if it's not the right procedure for you, Dr. Carlisle is going to say, I'm sorry, it's just not good for you. And that's really important to have a surgeon that's going to tell you no. And then also our technology. It's just, you can't get better than our technology. And also the fact that we track it and we're always adjusting to make sure that our outcomes are good. Our outcomes, 99% of our patients see 20/25 or better at the 3-month mark. And lastly, outcomes. Outcomes is important because you want to make sure that your LASIK facility or your LASIK provider cares about how their patients are seeing a week after surgery, a month after surgery, a year after surgery, and more. And the only way that these providers, we can get better is if we track the results and make sure that we're living up to our own standards as well as industry standards. We do that a few ways here. We document every single outcome every time someone comes in for a follow-up visit after the surgery. So the first thing that happens after someone comes out of surgery is their chart goes into a room where the first entry of outcome analysis happens. And then every time after that, when they come to us for follow-up visits, that's documented. And we keep close tabs as far as what our results are. So the three things, experience, technology, and outcomes, those are the three things that you need to remember when you're choosing a LASIK surgeon. And so I'm going to introduce Dr. Carlisle in just a second. I just wanted to let you know that Dr. Carlisle has been doing laser vision correction as well as general ophthalmology since 1993. He's Atlanta born and raised. He went to Emory University as well as the Medical College of Georgia, and he is a member of ophthalmology associations such as American Academy of Ophthalmology, American Society of Cataract and Refractive Surgeons, and the Georgia Society of Ophthalmology. So without further ado, Dr. Carlisle.
Thanks, John. Hi. Welcome. Thanks for coming out tonight. We appreciate having you here, and I appreciate the chance to get to speak with you. I'll apologize in advance. Sometimes I get ahead of myself on the slides, so I maybe get to talking and then realize, oh, yeah, I got ahead on the slide, so we'll just roll with it. And some of this is redundant, but we want some of it to be redundant because you need to hear some of these things more than once as far as the technology and our philosophy and how we do things. The main thing that I want to communicate to people is our philosophy, how we choose patients and whether or not it makes sense for them, things about having realistic expectations and goals, kind of understanding how our eyes work, which is very much involved in having realistic expectations and goals, and then letting people know whether or not it makes sense for them or not. And there are several criteria that we use for that. We've got proven results. Our statistics are excellent with how our patients do, and our enhancement rate is extremely low. The VisX platform is the most widely used platform in the world. The VisX platform is one of the 2 original lasers that were first approved by the FDA, but of course this is multiple generations down the line. They've improved it over the years, and what we have is the latest and best technology with the laser, both for doing the reshaping of the cornea and for creating the flap. So ours is a true bladeless LASIK. We create the flap with a laser, and we do the reshaping of the cornea with a laser. With the technology that we have today, what we like to do whenever we can is what we call the custom or wavefront guided treatments. And the custom view system, part of the VisX platform, it takes like a fingerprint of your eye for each individual. It looks at what are called higher order imperfections in the focusing. We've always known those were there, but we didn't have a reliable way to measure them until the last several years, and that's where the custom technology comes into play. And so what this equipment does is it measures what it takes to get the best focus of the light on the back of the eye for each eye That's why I say it's like taking a fingerprint of each eye and looks at these higher order imperfections that are beyond just nearsightedness, farsightedness, and astigmatism. And if you can get reliable data with this equipment, then you can transfer that directly to the laser and it can do a custom reshaping based on that. And what you get are better outcomes. You get a higher percentage of patients with 20/20 or better vision. And you also get fewer side effects. With the custom technology, patients are twice as likely to tell us that their night vision's better than they are to tell us it's worse. In the old days with the earlier generation lasers, you often had patients who did have difficulties with glare and halos around lights and such as that. And when the custom technology came along, most of those side effect symptoms went away. So you hardly ever experience that anymore. The flap is created with the femtosecond laser. That's the Intralase. The one we have is the latest iteration of that. It's the current most advanced generation in the femtosecond laser for creating the flap. It's faster and creates a smoother bed than the previous generations. And it's also more customizable. We can alter the shape and the contour of that flap for each individual patient, or to take advantage of certain situations where we think there might be an advantage to shape it in one way versus another. And then with the VisX laser, with the excimer laser, we do the reshaping based on the custom technology that we've acquired as part of your workup to get you prepared for the laser surgery. A common issue for patients with regard to being less dependent on glasses has to do with the distance and reading. In our youth, our natural lens has an ability to flex and change back and forth from distance to near. But every year of life, we lose a little bit of that ability. A 5-year-old can focus closer than a 10-year-old, closer than a 15, 20, 25, 30, 35, 40. You start to reach a point where if you hold it close enough, you can't get it in focus anymore because the natural lens in the eye can't flex to accommodate that, to allow you to bring it in close. And that's what we call presbyopia. So everyone who's beyond their late 30s or early 40s are beginning to experience that. And if we give those patients their best distance vision, then they're going to need reading glasses. And a lot of patients think, oh, well, no, I can see fine up close. Well, that's because they're nearsighted. They may be 50 and seeing well up close, but that's because they're nearsighted. They take their glasses off when they want to read. But if we do the laser correction and eliminate their nearsightedness, then they're not nearsighted anymore. They lose that. And so then they have to put on reading glasses in order to see up close. So one thing we can do for those patients with the surgery is what's called monovision. Patients do it frequently in contact lenses, where we'll correct one eye for distance and leave one eye nearsighted for up close. And it works quite well for lots of people. And we'll often do it, if patients have never experienced it in contacts, then we often do a trial of it in the office and show them what it's like before doing it surgically. But that gives people an option to be less dependent on glasses in general if that's their goal, is to do what we call monovision, where you have one eye corrected for distance and one eye corrected for reading. It's a compromise, but it works well for lots of patients. And we don't charge any extra for that. In fact, if patients can read comfortably without glasses, then sometimes you can just treat one eye. And that's half as expensive. Then you just leave the other eye alone, and that works wonderfully for people. I had 2 patients today that we treated that way. There are 2 basic ways that we can do the LASIK. There's LASIK with a flap and LASIK without a flap. And there can be medical reasons why one type of procedure makes more sense for a patient than another that are based on things like dryness of the eye, the thickness of the cornea, the shape and contour of the cornea. So occasionally we'll have a patient who has a thickness or a shape or a contour or a dryness situation where we think it would be unwise to create a flap in this eye. And in those patients, we'll recommend doing LASIK without a flap, which is also called PRK. And basically you use the laser to do the same thing to reshape the cornea, to change the prescription of the cornea, but you don't create a flap. The advantages can be many depending on the patient's medical situation with their eyes. The disadvantage is that there's a longer recovery time. There's more healing that has to take place when you do it without a flap, and the vision recovery is longer. But in some patients, it's what makes the most sense, and that's one of the things we advise you about when we do your screening. And they're basically There are basically, I'd say, 5 things that we're looking at when we're deciding whether or not it makes sense for a patient. One would be their motivation, the reason that they want to have LASIK, whether their goals that they're trying to achieve. So we like to talk to the patients about that. The other things we look at are the thickness of the cornea, the tear production, whether or not they have a tendency toward a dryness issue, the shape or contour of the cornea, and then the prescription numbers. So there are limits to how much correction can be done, and that can be influenced by the shape of the cornea and by the thickness of it. And so those are the kind of things that can make patients a candidate or a non-candidate, or might make us recommend doing LASIK without a flap or LASIK with a flap. I'll let John take it up with this process, and then I'll be back up to answer any questions that you might have.
Okay, I just wanted to talk a little bit about the scheduling process in our consultation. Every facility works it a little different. I think that our consultation process really allows the patient to get a good feel for us, also get a good feel about which procedure is best for them, and leave here a LASIK expert. And so that's our goal really in the consult. During our consultations, the first thing that we're going to do is do a detailed eye exam. So you're going to have a very, very thorough eye exam where we're going to look in the front of your eye, we're going to look in the back of your eye. Yes, you are dilated at this exam, and we're going to make sure that your eye is healthy. Also, we're going to find out what are your needs. Do you shoot a gun? Do you play golf? Do you need it for, are you an artist? We're going to find out what you want to accomplish by having laser vision correction, and then we'll customize the procedure just for your needs. We determine your candidacy by doing testing, by the doctor looking in the front and the back of your eye. And with that, we determine whether things such as your cornea is thick enough and that your expectations meet what we can do for you. At the end of the consultation, you'll meet with one of our surgery counselors where we're going to go over pricing, scheduling, financing, and make sure any question's been answered for you. And then, of course, we can schedule your your procedure at the end of your consult. Our LASIK consultations, number one, are free, no obligation consultations. They're thorough and they last about an hour and a half. And again, yes, you are dilated at it. Usually you can, most people can drive them home from it. We give you some sunglasses, and up close vision is difficult, and also light sensitivity, but reading road signs and such as that is fine, so usually you can drive home from your consultation. Also, in most cases, a person could have the surgery as early as the next day. And so also minimum recovery after the surgery. So you can have your consultation if you're a good candidate. You do have to be out of your contact lenses for 2 weeks prior to surgery. If you had them out, you had your consultation, you literally, if it was a surgery day, the next day could have surgery. And then 1 day later, you're back to regular aerobic activity and back to life for the most part, most of the people. So that's why laser vision correction is so popular, because there's a really quick turnaround and a really quick recovery normally. How do you pay for it? There's a few ways. People use their flexible spending accounts or their health savings accounts. That does qualify that you can use that for laser vision correction. We also offer special no-interest financing through Care Credit. You can find that on our website, a link to that. It's no prepayment penalty and no money down. And we do up to 18-month interest-free financing. And also we take cash check or major credit card. I'm going to end the seminar before Dr. Carlisle comes back up with just some words from the patients that have had surgery with us, just so that you get an idea of how they feel about it.
Hi, I'm Chris. I want to thank the whole team here at Thomas Eye Group. The great service, Dr. Carlisle especially, felt very comfortable. I think yesterday morning I could probably barely see my hand in front of my face before this whole situation. And literally by 12:30 when I woke up from my nap, I could see road signs, I could see things 20, 30 feet away from me. It was quite a revolutionary experience, if you will. I've loved the Thomas Eye Group. I thought it was a great experience.
The staff here at Thomas Eye Group, they're They're really some of the best here in greater Atlanta. I'm really glad I chose to come here. The surgery itself takes about 10 minutes. Dr. Carlisle is very experienced and somebody that I trusted to be able to work on something so vital as my eyes.
Dr. Carlisle was an awesome surgeon. He helped me a lot along the way, and any questions I had, Thomas Eye Group answered right away. And I loved the outcome of it. It was totally a great decision.
That was probably the easiest medical procedure I ever went through, and now I'm already seeing more clearly. I'm driving around without my glasses. I'm doing everything without my glasses. I put them away in the drawer and don't even worry about them anymore.
This has been the best experience. It was so easy and completely pain-free. I can't say enough about how great they are here at Thomas Eye Group.
The people at Thomas Eye Group, I just really want to say thank you because they really took care of me. The day after I got the surgery, I came in for an appointment and I could see then. And now 2 weeks later, it was just getting better and better.
It's the greatest thing ever. I don't have to deal with contacts or glasses or anything. I have great vision. The experience was so wonderful. Jackie and the staff here at the offices were so great and helpful to me, and they held my hand through all of it. I've even brought my daughter in for her surgery, see if she can be a candidate.
Really glad I came here and definitely already recommending to my friends to come here if they're looking to explore LASIK.
Thanks again, everybody at Thomas Eye Group. You did a great job.